This video will outline study procedures and drug reconstitution, administration, and documentation processes for the SuDDICU trial. The SuDDICU trial is evaluating the effectiveness of selective decontamination of the digestive tract, a prophylactic antibiotic regimen for reducing mortality in critically ill mechanically ventilated patients. The trial is being conducted in Canada, the UK, and Australia, and hopes are to recruit approximately 12,000 patients. The SuDDICU trial intervention includes 3 components: a gastric suspension comprising colistin, tobramycin, and nystatin administered 4 times daily from commencement of mechanical ventilation until the time of extubation, an oral paste containing colistin, tobramycin, and nystatin administered 4 times daily from commencement of mechanical ventilation until the time of extubation, and IV cefotaxime or ceftriaxone for the first 4 days of mechanical ventilation. Please note, if your patient is already prescribed a broad-spectrum intravenous antibiotic for other clinical indications, they will not be prescribed additional IV cefotaxime or ceftriaxone. Patients who are cephalosporin allergic will be prescribed ciprofloxacin for the first 4 days of mechanical ventilation. All patients newly initiated on mechanical ventilation, as in those patients ventilated on ICU admission or those that are newly ventilated in the ICU, are potentially eligible for the study. Those patients anticipated to be mechanically ventilated at least 48 hours either on or following ICU admission are to be included in the trial and should receive prompt commencement of the SuDDICU trial intervention. Please note written consent is not required before commencing the SuDDICU trial intervention. Each SDD kit contains a 5-day supply of SDD treatment, including 1 gastric suspension bottle containing SDD powder and 20 1 milliliter syringes containing SDD oral paste. If commencing SDD during normal working hours, your ICU research coordinator will assign your patient an SDD kit number and will affix a patient identification label to the outside of the kit, the SDD suspension bottle, and each of the 20 SDD oral paste syringes. If commencing SDD outside of normal working hours, you will need to take a new kit from the temperature-controlled refrigerator in which the SDD kits are stored. Attach your patient's identification label to the outside of the SDD kit, as well as to the gastric suspension bottle, and to a sufficient number of 1 milliliter syringes to last until your ICU research coordinator is available to label the rest. Never use more than 1 SDD kit for your patient at any given time. SDD oral paste and SDD gastric suspension must be from the same SDD kit. Also, never share SDD kits between patients. Before giving the first dose of SDD gastric suspension, you will need to reconstitute it with sterile water. To start, remove the cap and the seal if it does not come away with the cap. Add 100 milliliters of sterile water. Replace the cap and immediately shake the bottle vigorously until all the powder is well dispersed. Add further sterile water up to the 210 milliliter graduation on the side of the gastric suspension bottle. Once again, replace the cap and immediately shake the bottle until all the powder is well dispersed. Allow any bubbles to disperse by resting the suspension. Remove the cap and insert the adapter supplied by the kit by pushing it firmly into the bottleneck. If not using immediately, replace the cap. Write the discard date on the gastric suspension label. The discard date will be 10 days after the day of reconstitution. Return the gastric suspension bottle to the SDD kit and place the kit in the temperature-controlled refrigerator. The SDD gastric suspension is administered 4 times daily. Remove your patient's allocated SDD kit confirming the correct kit number from the temperature-controlled refrigerator. Before each SDD gastric suspension administration, shake the bottle of reconstituted suspension. Turn the bottle upside down and swirl so that any bubbles rise to the top. Using a 20 milliliter syringe, withdraw 10 milliliters of SDD gastric suspension via the adapter. Then aspirate 10 milliliters of sterile water into the syringe so that you have a total of 20 milliliters and mix. Immediately return the SDD gastric suspension bottle to the SDD kit and return the kit to the temperature-controlled refrigerator. Prior to giving the SDD gastric suspension, confirm that the correct patient will be receiving the correct SDD gastric suspension. Stop the gastric feed if your patient is being fed. Flush the gastric tube with a minimum of 20 ml of sterile water to flush feed from the tube. Administer the SDD gastric suspension via the gastric tube and again flush with a minimum of 20 milliliters of sterile water. Then recommence your patient's gastric feeding if applicable. You can administer the SDD gastric suspension either before or after other medications prescribed via the gastric route. However, the gastric tube must be flushed with a minimum of 20 milliliters of sterile water between each drug. If your patient's gastric tube is on free drainage, administer the SDD suspension followed by a minimum of 20 milliliters flush of sterile water. Then spigot the gastric tube and allow the suspension to dwell for a minimum of 20 minutes. If your patient has a jejunostomy or post-pyloric tube and a gastric tube, administer the SDD suspension using the gastric tube. If your patient has a jejunostomy or post-pyloric tube without a gastric tube, administer the SDD suspension as for a gastric tube, but consider a larger volume of sterile water to ensure the tube is adequately flushed. When you have completed administering the SDD suspension, document according to your unit's policy in the medication chart that you have administered the dose. The SDD oral paste is administered 4 times daily. Remove your patient's allocated SDD kit confirming the correct kit number from the temperature-controlled refrigerator. Select one SDD oral paste syringe. Each SDD oral syringe is equal to 1 dose. Return the SDD kit to its storage location. Before you administer each dose of SDD oral paste, it is important to provide routine oral care, such as toothbrushing and lip moistening. Ensure you remove any visible paste remaining in the mouth from the previous SDD dose. Prior to giving the SDD oral paste, confirm that the correct patient will be receiving the correct SDD oral paste. Then apply half of 1 syringe of SDD oral paste to a moist mouth swab. Paint the paste evenly onto one buccal cavity inside of the cheek, gums, and onto the tongue, making sure you extend coverage to the back of the oropharynx. Apply the other half of this syringe to the swab and spread onto the other buccal cavity, gums, and any remaining areas of the tongue. On completion of drug administration, document according to your unit's policy in the medication chart that you have administered the SDD dose. Avoid performing oral hygiene within 2 hours of the application of the SDD oral paste unless clinically indicated.